You are watching the Doctalk show.
We've learned that children are most at risk of getting dental caries. However, there could be other groups of people who are equally susceptible to getting problems of the teeth. So let's find out from our dentists who these people could be. Dr. Nelson, apart from children, well, we know children, naturally, they love sweet things and they can't forget to brush their teeth. Could there be other groups of people who will get dental caries?
The highest susceptibility is in the elderly and the children. Yeah, but then in addition to that, you find that also certain systemic diseases can predispose one to caries. For example, diabetes mellitus, due to the high sugar levels that have even been detected in the fluid around the gums of the teeth. So those high sugar levels, they are needed by the bacteria we've already looked at, that Dr. Deborah described, that will eventually cause caries. Okay. Then in addition to that, caries have also been found in patients undergoing treatment for cancers of the head and neck, radiotherapy. Yeah, if you're receiving radiotherapy, then you have a high chance that you're going to have a decreased salivary flow due to the side effect of atrophy, or atrophy of the salivary glands, as well as reduced salivary flow in the mouth.
So they should take better care of their teeth.
Exactly, they need
patients.
better care of their teeth.
Because once
exactly, you shouldn't neglect their teeth. Because once you're on radiotherapy, you have a high chance that you're going to have a decreased salivary flow. And saliva really has quite a number of functions as regards buffering the acids that are secreted by the bacteria, and then also the saliva itself has the antiperoxidase system that gets rid of the bacteria that eventually result into the caries. Yes. And then also the cleansing effect. Saliva is really paramount.
Okay. And also, I think during these treatments, it's good for let's say for the different doctors to work together. It's not good for a patient to be undergoing radiotherapy when the two entities, the dentists and the radiotherapists, are not communicating. It's good to treat the patient as a whole for their own good. Also to advise patients to take a lot of water, because you know radiotherapy has lots of side effects. So for the dental side of it, it's good for them to take lots of water, do a lot of fluid intake, lots of fruits, to just help neutralize whatever is not happening right in the mouth. Okay. Yes.
Yes, so thank you for that. So talking about the dental caries per se, if someone, for whichever reason, fails to attend to them, fails to see the dentist, what could happen? Could anything go wrong, Dr. Deborah? Someone has a dental carie and they've ignored it. What would
Obviously, some patients most times seek help when they are in pain. But again, there are times when people have dental issues, but they are not in pain. They'll just see a tooth breaking. And like, doctor, my tooth broke. And like, where were you the whole time? And they'll be like, I was not in pain.
So that's the complication.
Because they wait for pain, they will seek help when the tooth has broken. And you know, the longer you stay, the longer the treatment, and the more expensive the treatment. Of course, what I would have treated you for a cavity or for a hole is not what I would treat for a fractured tooth. If the tooth is broken, I'll tell you a lot of things to do. We might need to treat the whole tooth. I don't know if some people have heard of root canal treatment. We might need to rebuild the tooth with cements, or even technology these days, they are artificial teeth. And when it moves to artificial teeth, some patients be overwhelmed and they're like, I can't handle the prices.
So it's kind of complicated treatment for the dental caries.
Yes, for caries. So the longer you stay, the longer you stay away from the dentist, the more complicated the condition and the more complicated and more expensive the treatment. So the earlier you visit the dentist, the better.
Dr. Nelson, tooth infections seem to be a common issue around dental caries. How is that a problem?
Okay, just like we earlier on saw that the tooth decay or caries migrates from the outermost layer to the inner layer. So once these bacteria encroach on the inner layer called the pulp, then the pulp undergoes what we call death or necrosis. So once that pulp dies, we are going to have products of pulp death accumulating at the tip of the root and then spreading into the neighboring soft tissues, causing what we call an abscess. And if that abscess is not treated at that point, then it will progress into the spaces. They are what we call facial spaces, because those are muscular spaces in the head and neck region. It can go below the mandible, below the tongue. Those are the submandibular and sublingual spaces. Then it can advance into the mediastinum. So it goes into the system.
It's kind of a spreading infection.
Exactly, a spreading infection.
From the tooth, a decay, and goes into the deeper structures.
Exactly.
Sometimes can end up in the brain and cause meningitis.
Exactly, cavernous sinus thrombosis. Yeah.
And we've also had, there are also cases of the heart being involved, all starting from a tooth decay.
Yeah.
Because you have those fragments, those bacteria which enter the bloodstream and they find their way into the heart and they cause disease.
Exactly.
Okay, so tooth decay is a very big issue for people to be aware about.
Yeah.
They should take it very seriously. If you have a problem with their teeth, always go for dental checks, and there is treatment available.
And you don't need to wait for the problem. You don't need to wait for the problem. You have to make it a routine to visit a dentist.
How often should they visit?
It is good to visit at least once a year. Once a year. If you're not in pain, make it a point to visit a dentist to just check how you're doing, to do a cleaning, routine professional cleaning. Because some of us think, hey, I brush normally. You think you brush normally, but you actually don't know how to brush. Sometimes we brush, but we are just damaging our teeth. We are damaging the gums. You damage the teeth in the process of brushing. So it is good to visit the dentist to just know the basic things of the right way to brush, which angle to put the toothbrush.
You want to demonstrate to us how exactly people should brush. So, but bottom line is there's some treatment available for tooth decay. Maybe Dr. Nelson, you could quickly tell us what would happen if someone has tooth decay. You know, they can be very anxious that they're going to see the dentist, but they don't know what exactly will happen. Are they going to remove the tooth? Yeah. What would happen to them?
Okay, there is quite a vast, wide range of treatment options depending on the location and the extent of the decay or the tooth damage. If it's involving the first inner two layers, the enamel and the dentin, a filling or a cementing or a dental cement can be enough, sufficient enough to cover up that area so that the decay doesn't spread deeper or wider.
It's just a small
on the surface. On the surface, that's involving the enamel and the dentin. And then for cases where the caries has progressed to involve the pulp, but it hasn't yet formed complete pulp depth.
That's like in the deeper structures of the
Exactly, deeper layer, the innermost layer, the pulp cavity or the pulp tissue. Then you can do a root canal treatment. Is one of the options. You just take out that nerve, fill the canals, and then cover up the tooth, put a crown, and the patient stays with their tooth. Or at that stage, you can also do an extraction.
They remove the whole tooth?
Yeah, you can remove the tooth. It's part of the treatment plan. Then for severe cases where you have a facial space involvement or abscesses spreading into the neighboring soft tissues, the best option would be to consider an extraction, possibly. Possibly to relieve the pus and then...
Okay, so people shouldn't wait for until it becomes very severe. To the stage of getting the tooth extracted.
Exactly.
So they should always have routine checks at least every year. Even 2 times is better every 6 months. So that if it's there, it is caught early and you can save your tooth from being removed.
And remember, prevention is better.
Yeah, definitely.
Okay, so after the break, I want to talk more about prevention. How do you prevent dental caries from happening in the first place? And how exactly we should brush our teeth. You know, we think we know how to brush, but we may not be doing it the correct way.
True.
So after the break, we shall discuss more about this. Send your comments on the social media platforms, Facebook, Twitter, also log on to our YouTube pages, and you can follow these videos from there. And yes, after the break, we shall come back to talk more about prevention of dental caries.
You are watching the Doctalk Show.